My name's Jamie Clapham, and I'm a physical therapist. I work for Monument Health, and I have been a physical therapist for 13 years. And physical therapists work with people of all ages, from newborns to our oldest patients, and we help regain function, regain the things you need to do every day: walking, running, climbing stairs, taking care of your pets. And we work in the hospital and in outpatient clinics in order to really help people get back to their lives. I've always been a science person, and so I loved biology and anatomy, and I also was always into sports. So I did, of course, had injuries along the way and did rehab, and then so I got kind of interested then. And then when I got to college, I got the opportunity to work with the sports teams and travel with them and do rehab with athletes, and that really got me even more interested in the field. So I actually have a master's degree, but I was the last of the master's degree, so now it's actually a doctoral level degree. So you go to college for 4 years, and in undergrad you can actually major in anything you like. You just have to take certain classes like chemistry and biology and anatomy, and then you go to graduate school for another 3 years. In graduate school, the first 2 years are all classwork, and then the last year is all hands-on internships. I think one of the best things that I did learn along the way was making sure you also learn what you don't like. I think sometimes we think we know what a career is, and so I would highly recommend to really observe and learn and interview people in a career that you think you like. I initially thought I wanted to be a dentist, and it turns out I did not want to at all. And I'm really glad I learned what I didn't like to actually help point me to what I did like. So there's really, one of the things I love about physical therapy is there is a broad spectrum. You can do anything from pediatrics to working in the school system to working in an outpatient clinic. I actually have a really good colleague who, she actually travels with Cirque du Soleil and on Broadway, because dancers and performers also need a therapist. So for the first 7 years of her career, she traveled around the world with dancers and performers doing physical therapy, which a lot of people wouldn't even picture a physical therapist doing. I personally work in inpatient, so I work with patients who need to be in the hospital for sometimes 2 months, taking therapy every day to learn how to walk again, how to talk again, how to be able to feed themselves, how to be able to dress themselves. So really intense therapy and really getting to know your patients, seeing them 1, 2, 3 hours a day. On the other hand, you can work in the hospital in the critical area where people are to the point they may still be on a ventilator, but you're actually the first person to help them sit up and the first person to help them stand up. So there's a really broad variety. I said some people like working with athletes, some people don't. Some people like working with kids, some people don't. And of course, yes, you could eventually open your own clinic, be a director of a clinic, do traveling physical therapy. There's just a really broad spectrum of things you can do within the field. I've learned flexibility. Even it's healthcare, and people are changing every minute, and so you may have a schedule at the beginning of the day, and by 9 o'clock your schedule's completely gone out the window, and you have to figure it out and think on the fly of how you're going to adapt. So being flexible is really important, and really learning to connect with people, and not just your patients, but physical therapists are a really important part of a team. So we work with social workers, case managers, nurses, doctors, the lab, x-ray, and learning how to communicate with those people and to all be successful for the patient as a team. And in any given day, that can be 10, 12, 14 different people that you're working with and communicating with, and being able to communicate with people in different ways is really important. I think probably it is the kind of the long after, when people come back to visit, or you see somebody in the grocery store, or you see somebody at the park, and it's somebody who says, I remember when you helped me stand up for the first time, and you see them walking. Or I sometimes get Christmas cards from people who say, look what I did. And I can remember the first day they walked or the first day they stood. And it kind of reminds you of those long, frustrating days, or days when you feel like you're not getting anywhere, and you really see that these people are gaining a part of themselves back, and it reminds you of why you do what you do. I believe I would. I ask myself sometimes, if I could do another career, what would I do? And it doesn't come as a quick answer. So I think that tells me that I'm doing the right thing. I do think as you progress in your career, like 5 years from now, I might be in a different area of physical therapy. I might be looking to manage. I might be in pediatrics because I was getting burned out with rehab. But again, that's the beauty of the field, is that you can change throughout your career. So I think I would still be here. I might be set in a different area of physical therapy, but I think I would still be in the therapy world. To me, any healthcare exposure is ideal. Some people aren't great with some of the things in the hospital that are perhaps a little messier, and that is part of what we do. So one of the things, like being a certified nurse's assistant or a CNA, you can actually begin doing that at 16 or 17, and I think that's really good. It's a very high need job, so that's one that would give you a lot of exposure to a lot of different kinds of patients in healthcare, and also physical therapy aides we have in the hospital. Some areas they call them techs, but they help us with cleaning our equipment, help us with organizing things and answering phones and helping us kind of run errands, and also even helping us physically with the patients. And I was a physical therapy aide for 2 years before I went to physical therapy school, and both of those are really good options. But really any of the, even a transporter in the hospital, just getting the opportunity to see the healthcare environment and some of the variety, the speed of that, any of those would be great for somebody looking to learn more about physical therapy. So physical therapy is pretty independent in the sense that if you think of it like a race, you have the start and you have the finish. Where you're finishing is kind of predetermined, but how you get there is, as a therapist, your decision. So if you decide that a patient needs to work on lifting things from the floor and how you're going to help them do that, it might be you put cones on the floor, it might be you play twister, it might be that you tell them, oh, you're going to have to clean up after your dog, let's practice that. Or it might be we need to do 10 squats. And every therapist is unique, so all of us have different ways we do things, which is kind of fun. And even working with other therapists, we learn and see therapists do other things, and you pick up along your career, you pick up different things and skills. And so yeah, you can, sometimes in the middle of a session, I'll say, you know what, I changed my mind, we're doing something different. And so you do have that freedom and flexibility within the hour, within your day, and within your treatment plans. I for sure would definitely observe, go and see different areas of physical therapy. Sometimes people have experience with therapy themselves, they break an arm, sprain an ankle, and that's what they believe that all physical therapy is like, but it's really not. So I suggest to observe in the hospital, observe pediatrics, observe athletic training, observe different areas of physical therapy, and then also just to really see what you really think about sciences. Do you like biology, anatomy? If you don't, it's probably not the way to go, but exploring those classes. And truly, I said again, interviewing most people in the healthcare field in general, we want people to be happy in what they do. We want our team members, who eventually will be some of you watching this. And so talking to them, asking them real, straightforward questions about what they like, what they don't like, and advice that they would give you.